Anti-mask movement in name of freedom of liberty swept the country.
It's horrible.
This is a revolution that's been needed for a long time.
In a restaurant in Florida, one can get free food if he or she is anti-mask. There are tons of supporters out there defending what they call their own medical decision.
What he is doing is standing up for the rights of people to make their own medical decisions, okay? And you know what? You want to call me selfish for not wearing a mask? I want to say to you,
yes,
all the
Rachel,
people calling me selfish, you're the one who's trying to force me a medical procedure so you can feel more safe.
To mask or not to mask, as if the controversy were not big enough, the Centers for Disease Control and Prevention updated its mask guidance in March, saying wearing a mask is no longer a mandate. More confusion followed.
It is confusing. It's worrisome to people.
President Joe Biden is backing up the CDC. It recommends people mask up in indoor public spaces if they live in areas with higher substantial transmission. That's most of the country. But only 8 states still require masks inside public spaces. And 5 of those say that'll change within the next couple months.
We believe that through the Department of Health, through all the data that we have, that we're trending in an area that's going to be very safe for our local districts to make up their decision.
The mixed messages leave a lot of people confused.
The reason why we have lost 1 million people in this country is because of that fight against human stupidity. I can tell you that the number of deaths that we would have been much more smaller if people just listened and did the right thing, if they had a little bit of common sense.
Every person is entitled to their own medical decision, or so some on the political right argued. While the politicization of mask wearing and vaccination continued, the virus transmitted and mutated non-stop through an exponentially infected population. A burden borne by none other than the country's medical workers.
As soon as we move one out, it's going to be filled almost immediately for another patient. And so we have people going above and beyond, but they are exhausted, just exhausted.
A shortage of personal protective equipment, or PPE, has made things worse since early 2020. Some people even used college graduation gowns for protection.
To hear these personal stories of people on the front lines that have nothing, that are begging for gowns, that are begging for any support that we can offer them and as fast as possible.
Qualified nurses! Hire more nurses!
Widespread stress and burnout, health and safety issues, depression and work-related post-traumatic stress disorder. As a result, nurses are quitting in droves all across the U.S., with 62% of hospitals reporting nurse vacancy rates higher than 7.5%. Rising demand and shrinking supply are forcing many U.S. hospitals to pay top dollar to get that much-needed help, if they can afford it, of course. The country's healthcare relies increasingly on travel nurses who can fill in when needed, at a price. Up to a whopping $5,000 or more a week. It weighs down on those hospitals that provide healthcare to the bulk of uninsured, low-income patients. And to add insult to injury, some U.S. hospitals have been forced to ration healthcare provisions.
We have had situations in here with COVID, with people this critical, where 2 people start to go bad at once. And you have to decide which room you run to. It's a hard decision to make.
Healthcare rationing has always been a reality in the U.S., and it's de facto rationing when patients are discriminated against because they can't afford out-of-pocket costs, or simply because they live in rural, remote communities. However, according to Kaiser Health News, some of the richest nonprofit hospital systems raked in millions in surplus in 2020 due to lopsided federal healthcare bailout grants, a recipe for disaster as richer hospitals got more and poorer got less.